Because we've got to begin to wrap up.
Hi, my name is Tasha Smith.
Tasha, can you speak up a little?
Oh, okay. My name is Tasha Smith, and I'm a Boston native. And for the past 9 years, I've served as a health educator from HIV/AIDS to asthma and diabetes. That was the last position I held at a health center. Mm-hmm. And over the years, I've understood a lot of topics centered around mental illness. My father actually, he suffers from schizophrenia. So I was able to understand what was going on as I grew up. But as a young child, he had suffered a breakdown. And I didn't really understand what was going on until I got older, and I started to correspond with him more when I was in college.
And you started to what?
Correspond with him more in college. Mm-hmm. It was more like a long-distance relationship. Still to this day, we talk on the phone all the time because he lives in the North Shore area. Mm-hmm. But my struggles have been coping mechanisms with a parent, a mentally ill parent, because some days, he's fine, and other days, the green monster can sometimes appear. And it's basically, it goes back to the childhood. My father's father and his siblings had a very, very abusive childhood. And my father suffered from schizophrenia, and two of my aunts became mentally ill also, out of maybe 6 children. Wow. And my father had a breakdown in his 30s. He heard voices, and all I can remember is visiting him in a hospital, and he was literally choking himself to death. So his eyes were bloodshot red, and that was like my fondest memory. He took off his sunglasses, and his eyes were as red as her blazer right there. And one of my aunt's friends' husbands actually witnessed him running through the backyards, having the breakdown. My mom at the time, she didn't understand what was going on because, again, we weren't always aware of the symptoms. Mm-hmm. So my question is, just at this point in my life, I have a great relationship with him also, but there are things aware, like in the Boston area, but again, the distance between Boston and North Shore kind of gets in the way of us. So I'm just wondering, is there suggested readings or coping mechanisms or groups? This woman over here had some nice suggestions about advisory boards. Mm-hmm. But my thing is just for my father sometime to take care of himself. I'll go visit him. He's also a diabetic. I'll administer his glucose monitor so I can see where his blood sugars are, all that stuff. But it's just the motivational piece with him sometime where, again, people that suffer from the illness, they don't want to shower. Sure. They have that amotivational syndrome. So it's just little things like that to get him more motivated. He sees a psychotherapist, he takes his medicines, but it's other things to get him more back into the everyday sector of life.
Well, one, I'm sorry for your pain, and I do thank you for just having the courage to share that this evening. Does anyone have anything that
I think that probably the biggest support group in the area is the National Alliance for the Mentally Ill.
Alliance?
Are you part of that?
NAMI,
National Alliance for the Mentally Ill. They're a group of relatives, family members who have someone in the family who suffers from mental illness. And they get together. They know a lot of the social services around the city that are available to people, and they provide each other. They have support groups within their own organization and so on. They're national, but they have local chapters.
If you go online, their website is www.nami.org.
Right, and also, I was going to say, Dell arranged for some brochures from NAMI that are up there. Thank you so much.
Also the National Mental Health Association as well.
Okay.
National Mental Health Association.
All right, thank you so much.
Thank you for that. Okay, we're about ready to wrap up.
Hi, my name is Phyllis, and I have schizophrenia, And I know that I developed it when I was 18, and I didn't understand the disease at all, and I suffered from the stigma, and I was in denial and all that. But I think that one of the reasons why I didn't comply to my medications was the side effects that they had because they're so strong.
Yes.
So you're dealing with somebody who probably doesn't think they have a problem anyway, and plus on top of that, dealing with these terrible side effects. So I think that's one of the big hindrances to people even taking their medications.
That's an excellent point. I thank you for sharing that with us.
I think that's a very important point. I can think of a lot of people right now who have gone off the medications because they can't stand the side effects. I mean, some of the antipsychotic agents, for instance, they know now make you gain a lot of weight. You will get obese and you will get diabetes. And when they start getting obese and so on, they go off the medication and then they have another breakdown. And all kinds of other side effects, from feeling like a zombie to not feeling like themselves, etc. People say, listen, I'm better off without the medication, and hope that they're not going to get sick again. But then they get sick again. So it's a real problem. And I think that people who give medications have to titrate it very carefully. You know, not slug someone with a very large dose first off. You know, give a little bit, see what works with the minimum side effects, the lowest dosages that might make a difference in how the person's behaving and feeling, instead of these standard, well, give them standard doses, 50 milligrams, so everybody gets 50 milligrams. People are very different, so it has to be managed in that way.
Okay, thank you very much. We're going to have to wrap up. Please go ahead. You have a question? You in the green? Hello?
Yeah.
Oh, did you just ask a question?
No.
Oh, that's what I thought. So I'm pointing to you, girl.
This is probably going to take all day. I mean, the answer, so, I mean, I'll just keep it brief. My question brief.
Please.
Okay.
Because we have to wrap up.
All right.
There's a class coming in.
My name is Naja Weich, and I'm project coordinator for a health outreach program for Black men called the Health Education and Learning Program for Black Males. And actually, we honored you, Dr. Poussaint, for your accomplishment some time ago at the Healthy Heroes Day event. I don't know if you remember. But this is actually going to prepare me. Like, this event is very timely because we're structuring a event of our own, and it's going to be for Black men. And I guess my question is, you know, what are some strategies that we could use to target that audience, especially one, you know, Black people, you know, in general, obviously we're afraid of the terms mental illness and all that kind of thing. There's a stigma. So, you know, zeroing in on Black men, is there anything that you would suggest, or even any of the brothers in the room right now, that they would...
Do you have the date for this event and everything?
May
Or not yet?
27th.
No, but so you have the date and the place and everything, right?
No.
Oh.
Yeah, I know.
Okay. Well, one thing that I would suggest to you is that to make sure, I don't know if you saw the flyer for this event, but to have flyers made.
Oh, yeah.
And then just leave, again, no stone unturned. There's a book over there called Black Men and Depression that I'll be happy to share with you. But it's about, I spoke at a church once, and they said to me that the altar call after my testimony, there were about 400 people who came up afterwards. And what I did was gave 20 different instances of what depression looks like. If you, as it looks like the sister now, because there are more Black women now who are dealing with starving themselves. It used to be just a white girl disease where you know, the anorexia and bulimia. But if on your flyer you have 10 different symptoms that we know means depression, it's likely to trigger something in someone. So that's one thing that I would suggest. Make sure you have a good, you know, attractive flyer and just list the symptoms. Are you feeling like this? Are you the strong one that everyone comes to and then you don't have anybody to go to? If you list those things, people will see themselves in it, and that's one way. And the other thing is just to meet and talk with as many people as you can, and don't go anywhere without those flyers. Leave them in taxis and buses, bathroom stalls, everywhere. Somebody's going to see it that needs it. That's my 2 cents. And we could talk about it later, but we do have to begin to wrap up.
Okay, my name is Virginia Cash-Kemp.
Hi, Virginia.
Good evening, everyone, and especially to our distinguished panel, and thank you, Ms. Williams. First, I will begin with you, Tracy. As a teacher of teenagers for 35 years and recently retired, I'm going to speak to you first, sweetheart. You're looking at a woman who is 65 years old and who is one of 9 living children out of a family of 15. Now, my father had chronic depression, but we didn't know that. I didn't know that until I took my issue, as Ms. Ross said, to God. And I believe he owns everything, so when he directed me to therapy, I went there, and I gave thanks to him for that. For those of you who know, God will take you, he will heal you, and then he will break you into pieces, and you're supposed to share your experience.
That's
pain
right.
is not to be kept.
That's
the purpose
right.
of pain is to share the remedy. And then to my
Amen.
colleague who was worried about the children you're teaching, take courses in adolescent psychology, go to workshops like this that speak to the needs of the teenagers and try to alleviate the stressors in and around the child's classroom. As I used to tell the teachers I mentored, you are supposed to make them forget their Charles Dickens existence outside of your classroom and make them excited about coming to your class. When you do that, at least they'll have one bright spot, one oasis in the middle of the day besides cafeteria, which is a big stressor for children. Additionally, for the brother who had a relative, now I told you one of 9 living out of 15. Now, I am the first person in my family to just embrace the illness, stop being in a denial that I have chronic depression. I have chronic depression. I have inherited what our father had. In talking with my doctor, he told me what Dr. Poussaint just told all of us. He has given me the smallest dosage of fluoxetine. That's the generic name for Prozac. I take 10 milligrams of that every day. When I told it to my other brothers and sisters, some of them went to their doctors, explained the same situation that I was expressing. Okay, and she wants me to hurry up. So let's go to real fast. But I do want him to hear this, though, because I hear his pain. And, sweetheart, I want you to know I love you. I love you for feeling their pain and wanting to do something about it. So what I'm saying to you, get one person to do it, sweetheart. One person in the family to do it. Take them aside, mentor them, love them, and encourage them. Get one person to do it, then they will be talking to peers. And you see, you invite it, do it at a family reunion, do it at Thanksgiving, do it like she was telling. You do it because they need help. Being depressed is painful. It's extraordinarily painful. I could not live with the pain, and I definitely didn't want to die. So I did what I had to do. And there was one other person who had a situation now, but I can't address it right now. With the flyers she told you to put out, oh, and my brother, have this lady to come to your school and talk to your children. Have a field day for them that's in-house. Please be in contact with him. Secondly, put the flyers in beauty salons. Put flyers in beauty salons. Put flyers in beauty salons and tell the sisters, if he's important in your life, bring him to this workshop on May 27th. Thank you, my brothers and sisters, and I love
you. Hi, everyone. You know what? I just wanted to say my name is Sheila, and I just wanted to employ all of you. You guys are great. You're doing a laudable thing. You're being brave. So I'm being brave right now. And it's so funny. I was a producer for Frontline for 5 years. And the second year of being a producer, and I was just inundated, and I could really relate to Terrie because a lot of times I had so much to do. And I wouldn't tell people that I would have these breathing problems. I would be in... I couldn't breathe, and we had to go to Los Angeles. I flew to Los Angeles, and I could not get out of the plane. So I called my cousin, and you know, I believe in God. I know God does do everything, but she's the Holy Ghost. Sheila, I've got the Holy Ghost. I'm coming down, and blah, blah, blah. So she flew to L.A. and the Holy Ghost, and I still had these breathing problems, and I found out that I'd suffered from panic attacks. And people would not believe. I would go in and say to the person, David Fanning, and I said, I have these panic attacks. I can't go anywhere. But if you're a producer and you're big, a lot of people think that you don't have mental illness and you don't have problems. But I still suffer from panic attacks. So this is a big thing for me to even get up to talk. And Nina, when we did Say It Loud, I did say it loud. on a mic was good because I couldn't see people. And one day I went to do a speaking engagement, and I said, God, please help me. I saw all these people, and I just started out, well, I wear my cowboy boots, and I started sweating. And then things just started rolling off my tongue. But I think once you realize that you have an illness, and I have the panic attacks, and you take care of it, you just feel so much better about sharing it. So
Sheila, thank you so much for that. One, just, in terms of being a public person and speaking about it, that's what we've got to do. And the other thing is people, the tiniest aspect of your story can have tremendous power over somebody else's life. Her just mentioning panic attacks is, people sometimes don't even know that those things exist. So thank you. Yes.
I have 3 quick questions and 1 comment.
3?
Yep, 1, 2, 3. First question, your mom did a movie about someone who had bipolar disease, and I wondered, was that something that was just a script for her, or did it come out of your family background? The second question was for Dr. Poussaint, and you wrote the book, Lay My Burden Down, about your brother. You're very successful, and I wondered how your brother's career was, and I wondered how your career and his perception of it impacted on his life. And then the third question was for Brother Moore. I wanted to know how your dad is now.
Okay, 1, 2, 3, guys. Thank you very much for your questions. Quickly.
I'm going to be very brief. That was a script that was given to her, but the movie is Out of Darkness that my mother did on the ABC television network, and she played a schizophrenic. It was a script, but she also produced the movie, and she's very, very connected with the work that she does. But we do have mental illness in our family, depression, bipolar, some schizophrenia. We have that in our family. We have alcoholism in our family. There was abuse in our family. We got it all. So that allowed her to tap into that, to have more compassion for that, and to also be able to look at things that happened with. I had one uncle, one of her brothers, who was a drug addict and ended up being murdered. And be able to look at him from a young boy and say, I wonder what he was dealing before the drugs. What was he dealing with? Yes. So I have memories of talking to her while she was doing that film about all that it opened up for her mind about our family.
Thank you.
Wow. Thank you, Rhonda. Alvin?
Briefly, you want to know how my brother influenced me?
No. I want to know, you're a successful psychiatrist. I want to know, if it did, maybe it didn't, did your career and your success impact on his life? What was his career like? And the fact that you're so successful, did that impact him in a negative way, or did it affect him at all? Sometimes sibling rivalries, I guess what I'm talking about.
I think it did affect him, and I was very aware of it. So when I won awards in school, I would not put him on the wall. He was always not doing as well as I was academically, and I think it bothered him a great deal. And it's interesting, when he had a nervous breakdown, now get this, and I'm just going to say, when he had his breakdown, when he went psychotic, he came to me and he said, you're white. And I said, what do you mean? Wow. He said, you're white. I'm black, you're white. And he was making some distinction in terms of I was doing well and he wasn't doing well. Then he got compulsive habit. He kept going into the bathroom and washing his hands and his arms and his shoulders. And I would say, what are you trying to do? He said, I'm trying to make myself white.
Wow.
When he was psychotic. So I mentioned earlier that race came into the picture. He started getting all race and bad things and his own illness somehow associated with his skin color. He was about my same complexion, by the way.
Was he well educated?
Pardon?
Was he well educated?
He went to a vocational high school for printing. He was not very academically oriented, but very smart. Okay? It was circumstance. But he also influenced me. The more I saw him deteriorate, the more driven I got to try to get out of East Harlem and be successful. And of course, my selection of the field of psychiatry has a lot to do with my brother.
Thank you.
Alvin, just a quick follow-up on that. When your brother died, was it Was suicide acknowledged in any way? Was this spoken about in your family?
No, we saw it as see, you can't, when people are sticking needles in their arms and taking drugs, often you don't know whether it's a suicide or not when they overdose. You realize that, but it's kind of an accidental death. But a lot of those are suicides. I saw my brother as doing a lot of high-risk things that almost killed him before, including almost overdosing. But he was using needles, and he got meningitis, acute meningitis, severe, and died within like 2 or 3 days in his early 40s. So that's why I say he was engaged in a lot of things that could have killed him. You know, from stealing to robbing, in and out of jail, to all kinds of things that you felt he was destined for an early death.
Okay, thank you, Alvin. Tracy?
Yeah, my father is still chronically depressed. You know, he's gone through treatment, therapy, and I don't know, it seems that it doesn't really help.
Now can I have a comment?
Go ahead. 2 seconds.
1 second.
That's it.
No.
Thank you very much. Thank you very much.
Healing the Shame That Binds by John Bradshaw.
I'm sorry, say that again?
There's a book called Healing the Shame That Binds by John Bradshaw, and as I listen to people in here express their pain and their struggles, I thought of that book. It's been a great book for me. And also to say about the demon. In the Bible, Jesus cast out the demons. There was the one that had the legion, and then there was a man with a demonic spirit. So demonology, for some people in the Christian setting, is very, very real. And I guess I'm done. I'm not going to say
Thank you so
else.
much. I wanted to just mention something because I think this is also an issue. In Rhonda's article, there was something that really stuck out, and I wanted to just mention because it has to do with just color in our community. Of the 3 daughters, I was always told that I looked the most like our mother, but backstage I never got the accolades my sister received. It still amazes me that no matter how loud my mother's crowded dressing room became, I could always hear the voices that praised my sister's looks over my own. Isn't Tracy a knockout? And you watch my words, that chutney is going to be a model. Just thought about the pain of that and just how we, as black people in our community, you know, the light-skinned ones are the ones who are, and it's an issue that is a source of depression in our community, that dark-skinned people, in fact, there's an organization in New York that came to us, they wanted to do a public awareness campaign about how dark-skinned black boys are always relegated to the back of the classroom. And they wanted to make that an issue of just, you know, public awareness to administrators and around the country. Rhonda, do you have anything that you would like to say? Because we do have to wrap up about that or anything, any closing remarks that you might like to share?
Yes, thank you, Terrie, I do. What I want to share about that is that each of us, that example is each of our stories, in that context is everything. I'm not particularly dark-skinned. I'm not particularly...
Right.
I'm not.
Right. No, you're right.
But growing up, I always felt I was because of the comparison to my biracial sisters. So I say that to say context is everything.
That's
Each
true.
of us have our own struggles, whether it be on the side of clinically, medically, chemically schizophrenic to someone with feeling the blues or panic attacks, or I have to work on my self-esteem today, or whatever. That we all have our own struggles, and we can't allow anyone to tell us that those struggles are less valid. They're very valid for each of us in our own ways and in our own context, within our own families, within our own situations. So I'm glad you mentioned that, because thank you.
Thank you. Alvin, closing? Anything closing you'd like to share? Briefly.
No, I'll just repeat what I said. I think we have to all become more activists, kind of like the moral equivalent of civil rights around health care issues. That if we don't care about our health, not a lot of other people are going to care about it. And I feel personally that during the civil rights movement, they frequently put health even though all the health facilities were segregated, you didn't hear about that, did you, very much, because they put it on a back burner. There was no one dealing with that too much. They had kind of left it alone when segregated health facilities was a life-death issue. You see what I mean? So somehow there's not the same glamour around health care and good health that there is around voting rights, education, what lunch counter you're sitting at, et cetera, et cetera, et cetera. And that we have to push it forward to make things happen for us around health care.
And just remember, even though we don't have copies of his book today, Dr. Poussaint's book, Lay My Burden Down, the bookstore will take orders, but just really do check it out. Altha? Closing?
I want to echo what Dr. Poussaint has just said, because as I told you, that's the passion in my life, advocating and getting the word out and making a difference. I would also, though, want everyone in this audience to understand and to also learn about those who believe that the things that we're saying, the fact that mental illnesses are real and that they're treatable, there are people out there who are pushing a very different agenda, and they're being heard also. And I think we just all need to be very, very well armed with good information to make good decisions about how to proceed in this.
Thank you, Altha. Tracy?
Yeah, I just like to remind everybody that, depression affects everybody, regardless of age, race, gender, regardless of intelligence level. So definitely be aware of that, be aware of the symptoms. And realize that it might be affecting one of your best friends, one of your family members, and definitely be willing to lend support to them. If you see that it's affecting them, let them know. Hey, I think you might want to go to, seek out help, go to a center. So definitely do all that.
Thank you.
Can I just quickly say that in addition to NAMI, there are support groups. In fact, tonight there are over 150 people meeting at McLean Hospital under MDDA, Manic Depressive and Depressive Association of Boston, MDDA Boston. The groups are held every Wednesday from 7 to 9 at McLean Hospital. There are over 13 subgroups that take place, and also at Mass General Hospital on Tuesday and Thursday from 7 to 9 p.m. And there's also, I believe, I'm not sure if it's, but anyway, there are also day groups at McLean Hospital under MDDA. Okay. So there's lots of support out there.
Thank you. We appreciate that bit of information. Is Carol Copeland here? Carol Copeland Thomas? No, yes, I do know. We do have to wrap up. We have to be out of here, so go ahead. Oh, yeah, I don't know if you all want to speak to that technically, but yes, it can be very much intergenerational. But listen, you guys, do you want, ask Altha afterwards for 2 seconds, okay? And I just want to say to you, it would just, you're welcome, whoever said that. I was going to ask if you could please just acknowledge our panelists. Thank you all again for being here. I'll be over there signing books if you want, but we have to be out of here without question at 5 minutes to 7. Without question. Thank you for being here.
Well, I'm now the coordinator of testing, and I had to get out there because the last